Thank you for joining today's presentation from the Health Connector, where we will present an overview of the Health Connector and resources available for those in need of health insurance coverage. Today's presentation is titled Health Insurance Options and Savings Through the Health Connector. We have a number of participants who have signed up today, but we will go ahead and get started at 10 a.m. as scheduled. Welcome. I'm Shaitra Sanders from the Massachusetts Health Connector. I will be facilitating today's session. I'm joined by my colleagues Nikki Conte and Melissa Montron, who will be presenting today's information, and we are here to help answer any questions you might have. I would like to take a moment to thank elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, just some information about our presentation format. Everyone's audio has been muted and video has been disabled. The presentation portion will last approximately about 30 minutes. Then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A functionality. We will be monitoring your questions throughout. Please do not disclose any personal information or protected health information when you ask your question, as others on the call may be able to see what you've written. If you have a specific personal scenario that you want to discuss with someone, we'll be providing contact information for the Health Connector's Customer Service Center and instructions on how to find help from a local navigator. We are recording today's webinar. Following today's meeting, you'll receive an email with the presentation along with a brief survey about the information we've shared, so there's no need to take detailed notes. Please complete the survey if possible, as we'd appreciate your feedback on today's session, and your input will help us develop future presentations. So without further ado, let's go ahead and get started with Nikki Conte.
Thanks so much, Shaitra, and thank you everyone for joining us today for this session. Shaitra, if you want to go on to the next slide, I'll take us through today's topics. I'll provide an overview of the Health Connector and touch base on the American Rescue Plan as it relates to Health Connector coverage. Then we'll go into some specifics about getting coverage for the Health Connector. Throughout the presentation, we'll spend lots of time talking about how you can get help with this process. We'll go over key takeaways and remind you of critical dates and steps that we want you to take in order to get your coverage, and also relay resources to you so you know where to find information when you're looking for things on your own. So let's go on to the next slide and just talk about what the Health Connector is. So we're the state's health insurance marketplace, and we offer coverage for individuals, families, small employers, basically anyone who needs access to health insurance who isn't able to get it either through their job, partner, or other source is able to come to the Health Connector and apply for coverage. Now, a lot of people who apply for coverage qualify for help paying their monthly premium. And as we're going through this, we'll be talking a lot about health insurance plans during the session, but it is important to note that people can also purchase dental coverage through the state's Health Connector. So going on to the next slide, I want to just talk a little bit here about the plans that are sold through the Health Connector. So here we want you to understand some differences between our plans, and also acknowledge that all of the plans that are sold through the Health Connector meet state and federal standards for coverage. So in Massachusetts, I'm hoping that many of you know, we do have an individual mandate. Adults do need to have health insurance coverage. And you can rest assured that if you purchase coverage through the Health Connector, we will never be faced with a penalty. Again, the Health Connector plans, any plan that you purchase through us meets coverage standards. Now, a little health insurance speak for you. I want you to know that all of the plans, whether they're health or dental plans, are considered qualified health or qualified dental plans. So as a consumer, when you're shopping, you get to choose from a variety of plans in your area from leading insurance companies in Massachusetts. So essentially, you're going to, enter your zip code and you can see what is available to you. And it will vary depending on where someone lives. Now, in the center here, I want to talk about something that's unique to marketplaces in general. So you can purchase a health plan and many people can get advanced premium tax credits. So people can qualify for these tax credits to reduce the cost of their monthly premium so that the annual cost of the plan that they choose is not more than 8.5% of their income. So if someone is seeking coverage, this is a change in a way in which tax credits are distributed. This is a change to the American Rescue Plan, but you do, in fact, have the ability to choose a plan that is not more than 8.5% of your income. Now, unique to Massachusetts, we have connector care plans. So people in lower income brackets who also meet other eligibility requirements could qualify for a low or no cost comprehensive insurance plan. So we'll talk more about the connector care plans as we go through the presentation today. But again, great plans, great benefits, low cost, not only low monthly premiums, but also low costs at point of service. You'll see here, we do offer catastrophic plans, and those are available to people under 30 years of age or with a hardship exemption. And just generally speaking, catastrophic plans cost less their monthly premiums cost less, but at point of service. So if you're going to see a specialist or fill a prescription, you'll find that there's a higher cost there, and the deductibles, for example, are higher. And that's how those plans are kept. The cost of the monthly premiums are kept low. And for some people, this works really well, but just want to kind of explain what a catastrophic plan is. And then, as I had mentioned before, we do offer dental plans for individuals, families, children, small employers, and that includes pediatric only plans and plans with low or high deductibles. So going on to the next slide, I started talking a little bit about the American Rescue Plan, but I'd like to explain it a bit for those who may be less familiar. So this was federal law signed into law, in March of this year. And what it does for health connector plans, or what it does for consumers, is it makes financial help with health insurance available to many more people. So a lot of people who get their plans through the Health Connector were already getting some savings. However, with the American Rescue Plan, even more people will see more savings. So we're very happy to be able to offer those or pass those savings on to consumers. And one of the things, I started talking a little bit about affordability of plans. A lot of people who didn't qualify for help before can now see lower monthly premiums because of some of the changes that have been made due to the American Rescue Plan. So going on to the next slide, we'll just clarify a little bit and talk through each of these points. So you can see that there's more help paying for monthly premium costs through the Health Connector. So if someone's income might have been too high before to qualify, they may now find that they do in fact qualify for some type of assistance. So instead of an income limit for financial help, help is going to be based on affordability. And people can get advanced premium tax credits that will lower the monthly cost of plans so that they could in fact purchase a plan that doesn't cost more than 8.5% of their income. Now, it's important to note that people can only get these American Rescue Plan savings if they enroll through the Health Connector. And we do have a new tool on our website that my colleague Melissa is going to step you through, where you can preview the costs for the health plans and see an estimate of what you might qualify for. So there, we do have an online application, but if you want to very quickly get an estimate, you can enter some brief information and see what exactly is available in your area and what your cost savings might be. Another key benefit that we want to make sure everyone on this webinar is aware of is that people who received unemployment income at any point in 2021 now have access to a low or no cost Connector Care health plan. So this benefit is available through the end of 2021. So even if someone didn't qualify for this Connector Care before, this is now basically a benefit because somebody received unemployment income in 2021. So we're very happy to continue to be offering it through the end of the calendar year. So going on to the next slide, I just want to show you very specifically where in the online application you would indicate that you received unemployment income. So this is just a sample screenshot of one of the web pages that you would be going through, one of the questions you'd be answering. So we need to know, when you're going through our application, we need to know some information about your annual income. And then we have a new question that basically is just asking, did you receive unemployment income in 2021? So by clicking yes, you're basically going to be kind of pulled into like a back-end process, and you will become eligible for a Connector Care plan. So going on to the next slide. Again, continuing on with the benefits of the American Rescue Plan, there was new help available to help pay for Cobra. Now, this help with Cobra payments started in April and ends at the end of September. So for some people, it was a great idea to keep or enroll in Cobra, stay in that coverage and receive that subsidy through the federal government. For others, it really was better to enroll in Health Connector plans. So it was, it's really, it's kind of a toss-up depending on someone's personal situation. But what we want to make sure you're aware of, especially those of you who are on this webinar who may be in this situation, when the helping for Cobra ends this month, people who chose to take up Cobra do have the option to get enrolled in Health Connector coverage. So losing help paying for that Cobra plan will be a qualifying event that lets someone enroll outside of the open enrollment period. So we're happy to be able to convey that. Now on slide 10, I won't spend a lot of time here because, as I said, my colleague Melissa is going to give you a live demo of the Get an Estimate tool. But I will just pick on, or I will select one example so that you have a sense of what premium rates were before the American Rescue Plan and what kinds of savings somebody could expect to see. Now, the savings are going to vary based on where somebody lives and their age. So if I take the example of the 50-year-old in Worcester, whose income is around $44,660. So before the American Rescue Plan, this person would have been eligible for advanced premium tax credits. Their premium would have been around $371. And now with the American Rescue Plan, their new monthly premium is $269.82. So we're looking at monthly savings of over $100. So, that $100 each month definitely adds up. So actually we're very happy to be able to show these savings. So going on to the next slide, I am now actually, I was so used to saying going on to the next slide. I'm going to hand the baton over to my colleague, Melissa, to go through a number of slides at this point.
Thank you so much, Nikki, and good morning, everyone. So I'm going to go over who can apply. So applying through the Health Connector, you should apply if you live in Massachusetts, are a U.S. citizen, U.S. national, or are otherwise lawfully present in the U.S. and don't have health insurance. You should not apply if you are enrolled in Medicare, Mass Health or Medicaid, or other public health coverage, are offered affordable comprehensive health insurance from an employer, or are in jail. When can you enroll? So the special enrollment period, anyone can continue to apply for health benefits anytime during the year, but special rules are in place for enrollment in Health Connector coverage during closed enrollment. The Health Connector's extended open enrollment period ended on July 23rd. Certain situations may qualify individuals for a special enrollment period, which is the SEP, which gives them up to 60 days to enroll in a Health Connector health plan. Loss of other health coverage, such as loss of job-based insurance, Cobra coverage ending, or loss of mass health coverage are examples of why someone may qualify. In addition, the Health Connector will have a special enrollment period available in the fall for those enrolled in Cobra, but are no longer eligible for federal subsidies. If you need coverage sooner, apply right away. You may find that you qualify for Mass Health. So applying for coverage. So there are 3 ways that you can apply for coverage at the Health Connector. The first way is online at mahealthconnector.org. And we also have a Spanish version of the application, which is mahealthconnector.org/ES. The second way is by phone, and the third way is with the help of a partner community organization or health center. There is one application to find out if you qualify for coverage through Health Connector, including help paying for coverage or for coverage through Mass Health or Medicaid. You will get letters from Health Connector and Mass Health that will tell you your next steps. So what do you need to apply? So you will need Social Security numbers for everyone applying if they have one, immigration documents for all non-US citizens who are applying if they have one. And if you need any type of more information on this, you can click on this link here, immigration documents. You would also need recent pay information if you have it, such as copies of your last 2 pay stubs, your unemployment amount, which is the monetary determination if you are collecting unemployment, information about your current income. And if you don't have all of the information above, give us what you have and we'll send a letter asking for more information if we need it. So the application for individuals and families. So again, as I had mentioned earlier, you can apply at mahealthconnector.org. And also we have a Spanish version, which is the mahealthconnector.org/ES. There is one application for the Health Connector, Help Paying, and Mass Health. So right here, we have the home page basically of the Health Connector. And it says here, circled here is sign in. So basically you would have to put in your login information. And if you don't have an account on the bottom, all you would have to do is create an account. So how do you enter income if you're unemployed? So when you complete an application, you'll be asked about your current income and your estimated income for the year. So what you want to do is enter your income, your current income as it is right now, including unemployment income. Then enter your expected yearly income based on what you think you'll make over the course of the year. When entering your yearly income, consider how much you've earned so far this year. Add any unemployment, including any extra dollars per week you may be receiving. If you think you'll be returning to work later this year, include what you may have earned. If your income changes later, update your income information so it is as correct as possible. Keep your income and application up to date. Remember to update your income if your employment situation changes. Keeping your income information as accurate as possible helps make sure you get the right amount of help paying for health and dental insurance, have a lower risk of owing money to the IRS when you file taxes next year. If you get advanced premium tax credit, which is the APTC, you can always adjust the amount by clicking the change tax credit link from the Find a Health Plan page of your application. If you adjust the slider tool to take less APTC, your monthly premium would be higher, but you might owe less to the IRS when you file your taxes. So now I'm going to bring this back to Nikki.
Thanks so much, Melissa. So let's go through some information about getting help with paying, excuse me. So as we had talked about, there are two kinds of help that you can get: advanced premium tax credits, and also you might be able to qualify for the Connector Care program. So we want you to understand that advanced premium tax credits, or APTCs, as we're talking about them throughout this presentation, these lower the premium amount you pay each month. Now, what happens is the IRS sends that tax credit directly to your insurance company. So that money doesn't come to you each month, it goes to them. So you just pay less each month. Now, as Melissa just said, you can apply some or all of your tax credit that you qualify for to your monthly premium payment. And some people choose to, their income is fluctuating right now. So they say, you know what, I'd like to, I'm going to use that slider tool and I'm going to make an adjustment here so that I can kind of reduce my risk at tax time. Now, for the Connected Care program, I just want to explain that the way in which those premium amounts are made low is because it's both a combination of federal advanced premium tax credits plus state dollars. Those two things combined reduce the monthly premium amount that you as a consumer pay. I mentioned earlier that Connector Care has low monthly premiums, low out-of-pocket costs, no deductibles. And then depending on the plan type you qualify for, you might choose a plan as low as $0 or as low as $133. Now, we have slides at the end of this presentation that give you a little bit more information about Connector Care premium amounts, but the Get an Estimate tool will also give you estimates of what those premiums could look like for you. So going on to the next slide, this slide just tries to explain a little bit more about income guidelines. So income guidelines are still very relevant for the Connector Care program. So for example, as you're going through the application, we need to know some information about you and your tax filing household. So if you're listening to this presentation and let's say you are a tax household of 2 and you're making less than $51,720 a year, you will likely qualify, and you meet all the other eligibility requirements, you will likely qualify for a Connector Care plan. And that Connector Care plan, again, low monthly premiums, no deductibles, and low costs at point of service. Now, I want to go over and explain a little bit about the advanced premium tax credits. So before the American Rescue Plan, people who had income up to 400% of the federal poverty level, those were the folks who got access to APTCs. Now, the American Rescue Plan removes the income limits for APTC help. So this went into effect in May of this year. So again, instead of an income limit, people are going to qualify for advanced premium tax credits based on affordability. So you'll enter information into the system, and the system is going to make a determination based on all of the information that you provide to us. And advanced premium tax credits are available to lower the monthly cost of a health plan. So you could choose to enroll in a plan that is not more than 8.5% of your income. And I'm saying that because we're going to the system will provide APTC so that your monthly premium is that your premium is no more than 8.5% of your income, but you could in fact choose to enroll in a different plan. You're not limited to that particular plan. You could choose to go up or go down. So going on to the next slide. Let's see here. Let's talk a little bit about choosing a plan and enrolling. Now, Melissa gave you lots of information about eligibility, but once you get through eligibility, once you get through that part of the application, it's time to choose the right plan for you. So we have some online tools where you can enter provider and medication preferences to find plans and pricing. So if there is a particular physician or facility that you want to be sure that you include or is included as part of your plan coverage, you can use the plan comparison tool. Now, you'll get this presentation. You'll be able to click on this link. You can use that plan comparison tool when you're in the application or on your own before you even go down, like you go into the application. The other tool here, as I keep mentioning, and I apologize for repeating myself, but I want to be sure you all have this information. We're going to show you how to use that Get an Estimate tool so you can find pricing from the insurance companies in your area. So on the next slide, this slide is just an example of what the search tool looks like, what the plan comparison tool looks like when you're in the application. So you have the ability to look for your preferred providers and facilities, as well as your preferred prescription drugs. So you'll notice on this screen, I just, the yes, I want help finding a plan is selected. And you could say, I want to use the provider and facilities tools or the or the preferred prescription drugs. So going on to the next slide. Once you enter your preferences, those preferences get included as part of your search results. So here you're seeing the find a health plan page. You're seeing all your search results. Circled on the left-hand side are the physicians and the facilities that I had put into my search when I took these screenshots. So you could see, okay, the plans to the right have, may or may not have these physicians and facilities, but I can see that on the right. So right now I'm sorting by my best match. I could also sort by cost and apply other filters as well. So if you've done any type of online shopping, I can assure you that these screens work very similar to any other shopping you've done and filtering, etc. So going on to the next slide here. Also, this is where I start, driving home some key dates and deadlines. If someone is required to make a payment, it has to be received by us received by us or to us by the 23rd of the month. So we need your payment before enrollment is considered complete. So if you need to make a payment, you can do that online. You click this make a payment button and follow the path online. So moving on to the next slide, I'm going to actually pass this back over to Melissa just to talk a little bit more about ways in which you can get help with this process.
Thank you so much, Nikki. So basically getting help, customer service and community partners. So basically I'm going to go over our information. So free enrollment assistance is available through the Health Connector, customer service, and across Massachusetts through community partner organizations. So our customer service number is 877-MA-ENROLL, and that number is 877-623-6765. And we also have a TTY number, and that number is 877-623-7773. And that's for people who are deaf, hard of hearing, or speech disabled. For information about hours, days of operation, and more, you can also go to the Health Connector Customer Service Call Center. We also have community partners who are trained and certified navigators and certified application counselors who speak many languages, can help you from application through enrollment into health insurance plans. They can answer questions about eligibility, the application, payments, plan details, and healthcare reform rules and requirements. It is recommended that you call ahead to schedule an appointment for help. To find help in your language, you can also go to Get Free Help Near You. And I'm now going to pass it back to Nikki.
Thanks, Melissa. So I'm going to go through some reminders, details in this key takeaways section. So again, here are some things we want you to know, and certainly we welcome any questions. These are the things we want to keep reminding you of, but do please enter any questions you have for us in the Q&A. So people whose income might have been too high in the past to qualify for help may now be eligible for Health Connector plans with savings. So that is because of the American Rescue Plan changes that we had discussed. Also really important, losing employer coverage is considered a qualifying life event, giving you a special enrollment period for enrolling through the Health Connector. We talked about the fact that losing access to paying for Cobra is also considered a qualifying event. So no, those people, if you are one of them, you will be able to shop outside of open enrollment. We want you to apply and compare your options through the Health Connector. You must do that within 60 days of losing your employer coverage or having some type of change that gives you that special enrollment period. And as Melissa mentioned, you can apply for coverage online, over the phone, or with the help of an assister. Now, something I want to stress here, and just acknowledge, because we do this webinar on a monthly basis, and we also share this type of information with different partners across Massachusetts. And one thing that has always come up is whether or not if someone's not feeling super comfortable technically, or they get the application started and then get stuck, like what happens? And we just want to assure you that if you start the process, if you create an account, if you get stuck at any point, you can call Health Connector customer service. You can call one of our partners in the community, so either a navigator organization or certified application counselor, make an appointment with one of those organizations, and they can help you. After you give them permission to access your account, they can help you pick up wherever you left off, and they can get you across the finish line. So we don't want to discourage anyone from getting started, but also don't want to leave anyone fearful that like, oh gosh, this is like a thing, this is complicated. You can, just start it, do as much as you can, and somebody can bring you across the line if you need that help. The last bullet here just acknowledges that some people who are going through this process will automatically get a special enrollment period and they can shop right away. On the next slide, we just remind you that if you get stuck, if you go through this process and you can't shop for a plan, just call customer service. They can, again, open your application with your permission and see where you got stuck and bring you across the line. Now, for those of you who are seeking coverage that starts October 1, we really need you to pay attention to these deadlines. So you need to complete an application, you need to pick a plan, enroll in that plan, and if you owe a monthly premium, you have to pay that first premium by the 23rd of the month so that your coverage can effectuate on October 1. We need your coverage to start on October 1. Now, I also want to share that technically somebody has the ability to choose coverage to start on the second month after you enroll. For some, that's best. So we want you to just know that. And as Melissa said, and hopefully I've stressed enough, you can get free help with this process. So somebody can help you with the application. They can help you with choosing a plan. And you can do that all for free through Health Connector customer service, as well as through our community partner organizations. So please call today to make an appointment. And before we go to your questions, I'd like to just give this back to Melissa, give the presentation back to Melissa, because I think she's going to take us through a demo of the Get an Estimate tool at this point. Melissa, does that work?
Yes, perfect. Thank you so much. I'm just going to share my screen if you can give me one quick second. Hopefully everyone can see. I'm now on the mahealthconnector.org homepage. And here on this page, if you go on the top to get an estimate, and you kind of hovered above the individuals and families and just click on that there. So this brings you to our get an estimate page. So if you scroll down, you want to choose your coverage year, which will be 2021. You want to enter the Massachusetts zip code, and I'm going to enter 02302. So then you want to enter what you think your household income will be for the year. So I'm just going to say 65,000. And this is for the entire household. Number of people in household, including people who may not need coverage. So I'm just going to say to a married couple. And age of head of household, I will say 35. And age of person 2, I will say 28. So I'm going to, so also right here, I just want to mention both of these people, I clicked on needs coverage. But you also have 2 other options here. This person is pregnant, or this person is disabled or blind, which basically that's another part of the eligibility process. But I'm just going to keep there that the person, both of these people need coverage. So now I'm going to go to my results. And then it's just a reminder that this isn't an application for health coverage. This is just an estimate. Continue. So now we have the estimated eligibility. So based on what I had entered, the household may qualify for an advanced premium tax credit to help lower your monthly health insurance premium costs. The maximum tax credit amount is $231. You are eligible for silver plans with monthly premium as low as $410.68. So now it says household member and the potential eligibility. So person number 1, which is the 35-year-old, does qualify for a Health Connector plan with advanced premium tax credit, and so does person number 2. So now we can also go ahead and preview the plans. So on this page here, it's basically giving us the estimated savings details. So the monthly APTC for tax household would be $231. So here we have like a breakdown. We have the carrier for the zip code that I had entered. We have the plan name. We have the coverage level and the monthly premium and the savings. So again, this is just an estimate. So if you scroll down, you have all of the possible choices that you can choose from. So if you feel satisfied with this and you feel comfortable at this point in time, if you wanted to apply, you have the option here to apply now.
So Melissa, could I just pop in and ask a question while you're here?
Sure, of course.
Could you just scroll up for a second?
Yeah.
So I just wanted to point out, so let's say someone chose to go with the second option, which was the Tufts Health Plan public plans.
Mm-hmm.
So you showed that the monthly premium was $663. The APTC savings are the same no matter what, right? No matter which plan they choose. But then the cost that they pay is actually listed in the last column.
Exactly, yes.
Okay, I just wanted to point that out for folks so that you can see your monthly premium will differ depending on which plan that you choose.
Oh, thank you for pointing that out. Yes.
Yep, no worries, no worries.
Okay. So I'm going to stop sharing my screen now, and we can move forward with questions.
All right, ladies. Well, I believe there are a few questions that I can get directed to either one of you. All right. So one of the questions today, either Nikki or Melissa hopefully can answer this. If I have been receiving unemployment benefits throughout 2021, but did not get the low monthly rate until August 1st, can I get a credit for the months that I paid in full?
Yep. So thank you so much. I'm not sure who asked this question, but thank you. So it's not exactly a credit for what you had paid. Instead, when you file your taxes for this year, if you were enrolled through the Health Connector in a Health Connector plan, but you did not get any of those advanced premium tax credits, what you will do is basically reconcile your taxes, indicate on your taxes. I don't want to get into that level of detail because I'm not sure exactly how that works. But my understanding is that you will be able to collect or get tax credits back at tax time. So when you file taxes for calendar year 2021, you'll be able to get dollars back for those months that you weren't able to yet enroll in the Connector Care Plan. So I also want to, at this point, I wouldn't mind just confirming with my colleague Kayla, if you can. Is there anything else we'd want to advise someone who's in this situation? Because I know it's really important that they were enrolled in a Health Connector plan. They need to be have been enrolled in a Marketplace plan. But I don't know if there's any other thing that we need them to be aware of.
Yeah, no, I think that covers it. I would just say, like you said, Nikki, the important thing is that they were enrolled in the plan with us. We knew about them. And at the end of the year, it's great that they were enrolled with us earlier in the year, because they should get that money back at tax time if they were eligible. So I think that person, hopefully will be able to go through that process, and they should contact us, of course, with any questions, but they should be good to go at the end of the year.
Yep. And so maybe it's helpful to acknowledge for people who never enrolled in a Health Connector plan with premium tax credits, when we go through at the end of the year at tax time, the Health Connector is going to send you different forms. One of the forms that you would use when at tax filing time, it actually would list the plan that you enrolled in, and then also the advanced premium tax credits that you received. So either you'd use that form yourself to file your taxes, or you'd collect all that information and provide it to your tax preparer so they can assist you with that process.
All right. Another question. Can I access out-of-state care with the Health Connector insurance plans other than through an urgent care center or emergency room?
Okay, so this is a question we've recently received. I think we might need to do a little follow-up, but generally speaking, it is going to be, you're going to be limited by your plan's network. So what I mean by that is, we are living in Massachusetts, where Massachusetts residents and networks are Massachusetts networks. My understanding is that some of the networks kind of, I think they cross over New Hampshire, Rhode Island, they do cross over our border lines a little bit. So I would check the network that you are enrolled in. But if you're outside of Massachusetts for a period of time during the year, our plans typically don't cover routine care outside of Massachusetts. So this is something, if you are purchasing coverage and you're going to spend 6 months in Massachusetts, 6 months in Florida, I would double check with the plan just to make sure that you're able to get exactly what you need when you're not outside of Massachusetts. The other blanket statement I want to make is that, yes, of course, if you have a plan through the Health Connector and then there is an emergency outside of Massachusetts in another state in the country, you can access emergency services.
And I believe it was Melissa who stated before, when you are applying, you do have to be a Massachusetts resident to apply.
Yes, thank you for saying that. And another session we recently had, people were asking us about, well, what if I just moved here? How do I prove, like, are there any limits? And when you're going through the application, you have to simply attest that you are intending to reside in Massachusetts. That is it. I am now a Massachusetts resident, or even, let's say, we've gotten this question from parents of young adults who are planning to move to Massachusetts. We're helping them with this process, and we just say, yes, you can apply before you actually move here, again, because of your intending to reside in Massachusetts. Melissa, is there anything else you'd add here? Because I know you help work with people one-on-one, so I don't know if there's anything else about Mass residency that we'd want people to know about.
No, I think you covered everything. It's perfect. Thank you.
Well, the next question is going to be geared towards Melissa, since you actually showed us the Get Estimate tool. Someone had a question while you were showing the Get an Estimate tool, about how, you're looking at the plans, as Nikki pointed out, is from the plan and the plan name and how much you pay. But when you're looking at that screen, how do you know what the benefits in each plan are from that screen?
So basically, when you do the application, if you want to see the details to each benefit, you can go into the plan details, and it does provide you with exactly what is covered. It basically gives you an overview of what is covered, if you need to do a co-payment for each coverage, and what exactly you are responsible for that coverage.
Is that available in the Get Estimate tool portion, or is that only in the application?
I believe that's only in the application. I don't think that it goes into detail on the Get Estimate tool. The Get Estimate tool is basically just providing you with an estimate, nothing else. So if you want more detail, you would actually have to apply and find the details towards the end of the application. All you would have to do is, once you have your eligibility, if you click on the carrier link, I believe there's an option where you can get the plan details on that link.
And just to confirm, just to ease everyone's mind, just because you apply doesn't mean you are required to enroll. Am I correct?
Yes, you are correct. Yes.
All right. So application has the benefits and coverage, the summary of benefits and coverage, pretty much. So the next one. How does someone find out if they are eligible for the American Rescue Plan Cobra premium subsidies? Pretty much, I think this person was trying to find out what the processing time is to see if someone will be eligible for the assistance. So if you guys could just review again the timeline of when this is available, and then the timeline of when they find out if they can get this and put it towards their Cobra.
Yep. So just very quickly, the Cobra, the federal subsidies for Cobra benefits was from April of this year through September of this year. So it's actually ending at the end of this month. So I don't believe that this is something a person can take advantage of any longer. Kayla, is there anything else here?
Yeah, that's right. It ends at the end of the month. And what I would say for this question is that somebody should really reach out to their employer to find out what's going on. Employers are required to notice their employees who might be eligible for this benefit. You would have already received that notice, or should have, if you were eligible. But certainly worth reaching out to your employer. Just make sure you didn't miss anything, or there's no other information you should have on hand to sort that out. But yes, number one stop, employer.
Well, it looks like we actually don't have any questions right at the moment. If anyone has some last minute questions, please feel free to throw them at us right now. I would definitely want to go back to, Nikki and Melissa, if there's any like last minute things that you were thinking of while you were giving the presentation that you would like to speak on, just maybe from prior presentations that you think would be a good thing to share with this group.
Sure. I think there's one question that we usually get that I want to make sure like we just acknowledge in case this is on anyone's mind or you think about it later. A lot of times you get the question of who exactly do I need to include on this application? So when I think about my household, what is really who should I include? And everyone's household structure can be a little different, right? So it might not be as straightforward as you may think. So the Health Connector is interested in the tax filing household. So anyone who is, again, anyone that is part of your tax filing household, you want to include them on your application. The other thing is if someone in your tax filing household, you might be wondering, okay, do I need to include someone on the application who doesn't need coverage? And the answer is yes. You would include the person so that they're accounted for, but you have the ability to say they do not need coverage. So for example, this is something that comes up a lot with older couples where someone is already enrolled in Medicare and the other person is not there yet. So you would, again, tell us about the tax filing household. You enter information about both of you, indicate that this person doesn't need coverage because they have Medicare. We're not going to do anything to that person. We're not going to look for coverage for them. When you go on to shopping, the system will show you plans for you, the person who needs coverage. So that's just something I think that we get a lot, a question we get a lot. One other thing I'll throw out there in case anyone might be in this situation. If you are getting close to Medicare age, my recommendation would be to work with a SHINE counselor. So you can certainly, if you're not there yet and you're looking for coverage, certainly our doors are open for you, come on in. But once you become eligible for Medicare, you're no longer able to access, or you're no longer able to get subsidies through the Health Connector. And the rationale behind that is one of the things that Melissa had explained in her slides, which is if people are eligible for this government program, we're going to know that. And we're going to say, okay, because you're eligible for this, you're not going to be eligible for Health Connector plans with advanced premium tax credits. We have a lot of great SHINE counselors in Massachusetts, and they can help with this process. They can help make this process from going from Health Connector over to Medicare easier. So just for anyone out there who's listening that is is nearing Medicare age or needs to contemplate that.
Great. And I just thought of something, before we close out. I know someone, I'm not sure if it was Nikki or Melissa, someone mentioned that we are actually in a closed enrollment period right now. Would one of you just like to let us know, when does the open enrollment period start and what date would you be enrolling for during the open enrollment period?
Sure. Melissa, do you want to take this?
Sure. So our open enrollment begins November 1st. And again, if you are outside of the open enrollment period, we have the special enrollment period, which would qualify you to make changes or to come enroll with us. Yeah.
During the open enrollment period, would you be enrolling for the next month or would you be enrolling for January 1st of 2022?
For January 1st, 2022.
Yeah. So to piggyback on both your questions, Shaitra, and what Melissa has said, if anybody on this webinar or someone in your family or a friend needs coverage right now, we always say just apply. We share the Health Connector is the state's marketplace, but we are very closely very closely linked with our partners at Mass Health. So what that means is there's one application for coverage either in the state's health connector or through the state's health connector or Mass Health. So many people who apply find out that they in fact are eligible for Mass Health coverage. So just want to acknowledge that. I think we might have mentioned that on a couple of slides, but maybe it wasn't the focus of today's questions. So just want to acknowledge that for people that sometimes if you need coverage sooner, you may actually, depending on what the situation is now, especially with lots of things changing for people's income, sometimes people in fact are eligible for Mass Health.
Well, this has been a great webinar. I think we're finishing up at a great time. As noted earlier, this will be sent to everyone who registered. Am I correct? If they register, this will be sent to them. And also a survey will be sent that we, kindly ask that you please provide some feedback. It will definitely help us make improvements to future presentations. And, Nikki, Kayla, Melissa, thank you for assisting me with this presentation today. And I would like to thank everyone for joining our webinar today. And I would like to say from everyone here at the Health Connector, be safe and well.